We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for health system CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now.
Welcome to the Health System CXO Podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. My name is Anne Herleth, VP of Member Insights at the Health Management Academy, and your nurse executives host, discussing the issues that matter most to nurse executives, their leadership teams, and systems, and inspiring innovation across the practice and care continuum. Nurse executives and the broader nursing leadership team have been in the financial hot seat for years. And it's all because nursing is considered a cost center, something that I could and likely will argue is wrong, but I'll have to save that for another day. And now nurse executives have to wade through the rhetoric about the state of the nursing workforce with lots of quote unquote ideas on how we're going to solve the profession's ongoing challenges. These conversations swirl around the same issues: COVID-driven burnout, generational differences, shortages, labor costs, all real issues, but often viewed in isolation or not well examined beyond the surface level. And by the way, best practices, they aren't working anymore, which tells me we need to think about the challenges and solutions in a new way. I want to break down what's really going on in the nursing workforce and how executives, both nursing and non-nursing, should be thinking differently about the challenges and solutions. So let's get into it. First up, we have to talk about money, because there's no talking about the nursing workforce without level setting on health system finances. And for the first time in a few years, it's not all bad news. Health systems are starting to see some financial recovery, revenue growth finally outpacing expenses, thanks in part to the increased patient revenue and better market conditions. But before we break out the champagne, we can't forget about labor costs. Workforce expenses continue to eat at margins and remain the challenge to financial sustainability. There is an inverse relationship between health system operating margin and workforce costs, and systems that spend more on the workforce will continue to underperform on margins. Now, health systems have been working hard here and have been largely successful in containing workforce costs from travelers, contingent labor, all of those low-hanging fruit. But inflation in the labor expenses is still a concern, because even if inflation stabilizes, it's now at a permanently higher baseline. Take, for example, the last 2 years, from 2021 to 2023, the labor expense grew by over $180 billion. And while these data show a direct relationship between workforce costs and bottom line, it's also confirming that workforce challenges are a rate limiter to strategy and to growth opportunities. So what does this tell us? Here's my bottom line. We are pricing ourselves out of the current labor structure. We cannot continue to do business in the way that we've done it, and we can't continue to be so reliant on people labor to get the work done that happens within a health system. So that's number 1. Now, speaking of labor, it is, again, not all doom and gloom. For the first time in a number of years, RN turnover is finally showing signs of improvement. In 2021, we saw our peak when it came to turnover at 27%. And as of the end of 2023, nationally, that number has dropped to just over 18%. That is progress, at least on the turnover front. Shortages, though, those are another story. Let me start by saying I am not a huge fan of national shortage data. It's incomplete at best and used as a scare tactic at its worst. I like to equate it to a weather forecast in April: incomplete, unreliable, and riddled with caveats. But to understand the gist of nursing in the US, big consulting projections can be directionally helpful. The best data I have on RN shortages says we'll actively have a shortage by sometime next year, early 2025. But what really matters is what's going on in your market. Some of you may be rich in staff, while others are struggling to find RNs or other types of support roles. And shortages are not equal opportunity. They hit some regions a lot harder than others and can look really different. I mean, we know in rural areas, those organizations are still struggling to meet the baseline number of nurses that they need and are often running at high vacancy rates. But we also see some urban areas that have competitive trends that lead to shortages. I think St. Louis is notably one that continues to have on and off RN shortages simply because of competition. And while many groups will use shortage discussions to evoke certain types of emotions, it also means that we are overlooking what I would consider to be the real shortage when we focus on national shortage data. My best prediction is that we won't have a bleeding national shortage, at least on paper. The real shortage will be in the acute care setting, meaning we will look okay on paper, but we will be struggling to staff in the acute care setting. And I think that's going to happen across the board, not just in competitive markets, not just in rural areas. And this is actively happening because of what I like to call the big three. These are the big issues facing the stability of the nursing enterprise. And so I'm going to walk through these one by one. Number one, first-year turnover. Right now, first-year turnover in the US is 33%, and that has gone up year over year since pre-pandemic. And I'm talking about new nurse turnover. New nurses are communicating everything we need to know about the acute care setting with their feet. They do not like the job. They have no plans to stay. Some may be going back to get their DMP, others moving directly into outpatient facilities. It doesn't really matter. Regardless of everything else I share today, watching first-year RN turnover at an organizational level may be the single most important workforce trend to understand. Because even if we fix everything else, there will be no future acute care nursing workforce if a full third of RNs leave after their first year. That brings me to number two, workload. Nurses continue to be the catch-all role, and it is not sustainable. We all know this. Nurses talk about it all the time. Burnout is one of the biggest issues facing the nursing workforce, and it is not just because of COVID. Workload continues to run nurses into the ground, and we just have not cracked that nut. I say again and again that the first organization to figure out an AI solution that can solve the clinical documentation burden for nurses and be truly nurse-centric, I mean designed for nurses, implemented with nurses, figured out with nurses, and serving nurses, that company has a lot of money coming their way because workload, again and again, is burning nurses into the ground. And we have got to figure this one out. And finally, number three, clinical competence. And this is really the experience shortage. Those new nurses that stay, they stay at the bedside and they're struggling to build their clinical competence in a timely manner. This started pre-COVID and has much to do with the workload and the fast pace of the environment as it does with the disruption in clinical education. It's easy to say that COVID is the reason why new nurses are struggling to develop clinical competence, but we know that's not true. We have an education system that hasn't changed much in the last 30, 40, 50 years, maybe. We have a way that we onboard, that we train nurses that hasn't changed. And I think it's probably time for us to reconsider how we're bringing nurses into practice so that they're able to develop clinical competence in a way that suits the environment today. And so there you have it, the big three: first-year turnover, workload, and clinical competence. And these aren't just minor inconveniences. They are major roadblocks standing in the way of progress, innovation, and transformation. These are the reason why retention strategies are not going to fix the nursing workforce. We have to go bigger. And that bigger is transforming the care delivery model. I am not talking about tweaking around the edges. We need to ditch the outdated primary nursing model and embrace AI, technology, and other tools that can lighten the load and make nursing jobs desirable again. We cannot rely on mission to continue to be the driving force for people to want to be nurses, particularly in the acute care setting. We have to have jobs that nurses want. And the primary nursing model, it's just not working anymore. We need to create roles that nurses want, ones with more time with patients, less time doing clinical documentation and other admin burden. We need to rescope what it looks like to be a nurse, and particularly a nurse in the acute care setting, because really, that is the only way that we are going to engage the current workforce. Roles in which new nurses can learn and not just survive. Care delivery transformation is the key to unlocking the future nurse, and it's time that we all think outside the box. Care delivery transformation is the key to unlocking the future nurse. It's time that we think outside the box, and I'm here to help you do just that. Thank you for joining me on the Health System CXO Podcast, where we activate health system leaders towards outcomes and scalable solutions that you can implement now. Remember to subscribe to the Health System CXO Podcast on your favorite podcast platform so you never miss an opportunity to hear more. And if you liked the episode, consider leaving us a review and sharing our podcast with your colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.